Amblyopia is an eye condition that many people refer to as lazy eye. It is when you did not develop normal sight in an eye during early childhood, and that eye now has poor vision. Usually, only one eye is affected by amblyopia, but it is possible for both eyes to be lazy. Amblyopia is a common vision problem among children, and it has a number of causes. For instance, it can develop because the eyes are not lined up equally with each other. Or it can be caused by light not focusing properly in one eye, resulting in blurry vision in that eye. With amblyopia, vision loss happens because the brain favors the eye with stronger vision and basically ignores images from the weaker eye. Amblyopia is not always easy to spot. A child may not be aware that one eye is weaker than the other. Unless you notice an obvious symptom, such as one of the child's eyes pointing in a different direction than the other one, you may not know they have lazy eye. Treating amblyopia early is critical to saving sight. Leaving it untreated puts a child at risk for a lifetime of vision problems. The child may lose depth perception, which is the ability to tell how far an object is from you. And he or she may permanently lose a significant amount of vision in the weak eye. To treat amblyopia, you must make the weaker eye stronger in order to see normally. There are two ways that pediatric ophthalmologists do this. They may have your child wear a patch over the stronger eye, or they may blur the vision in the child's stronger eye with special eye drops or eye glasses with a blurry lens. In either case, the child is forced to use the weaker eye. Understandably, children do not like to have their strong eye patched or blurred. However, parents need to help their child do what is best for him or her. If your child is resisting wearing a patch for amblyopia treatment, here are some tips to help make it more successful. Provide a reward to your child for keeping the patch on for the prescribed amount of time. Have your child wear the patch while doing his or her favorite activities, like watching a movie or playing a video game. Ask family members, teachers, coaches, and others to provide plenty of encouragement and praise to your child when they wear the patch. Your pediatric ophthalmologist can discuss ways to work with your child to make sure they wear the patch as recommended. As a parent, you can make sure your child's amblyopia treatment is successful. Stay interested, stay involved, and be persistent. Your child's vision depends on it.